Now, let's talk about areas related to the Taiyin spleen. Observation of the spleen channel does not involve any special considerations. Nevertheless, observe changes along the skin surface. So you have to look for areas of redness, papules, or swelling. These are all possible indicators of abnormal spleen function. Pulse palpation of areas related to Taiyin spleen. There are no special pulses palpated along the spleen channel, but you should remember that the nature of pulsing along the abdomen on the Ren vessel may reflect the health of the spleen. Palpating the channel, pressing the points, and feeling the body surface. So if you feel a sense of mild pain with pressure at spleen 2 or spleen 3, this indicates spleen deficiency. So if you want to determine or if you want to confirm your diagnosis of spleen deficiency, then try palpating the points spleen 2 and spleen 3. And so there will be mild pain when you do that. So try doing that on yourselves. Spleen 2, spleen 3. So if there is sharp pain at spleen 4, it indicates dampness and heat in the channel, in the spleen channel. Heat accumulation manifests as swelling, pain, and itching in and around the eyes. So if you observe that your eyes begin to itch or the area around the eyes itch, then you might want to think of a spleen issue. Many types of eye disorders, such as styes, are due to spleen stomach heat toxin. So treatment with spleen 4 bilaterally will be very helpful. So try doing that if you have styes. If the eye swelling is severe, you may consider bleeding the tip of the ear. The area may also be just slightly sore in patterns of spleen deficiency that involve also dampness. So sharp pain with pressure at spleen 5, so sharp pain, may indicate damp heat encumbering the spleen, especially when there is a corresponding mouth ulcers or sores on the lips. No? So this can be treated to help with the pain of an acute outbreak, but long-term treatment must address the underlying spleen deficiency. So milder pain in the area at spleen 5 is also sometimes palpated when there is an imminent outbreak of chronic mouth sores. So chronic mouth sores to spleen 5. Spleen 6 is an area that will show changes in the presence of both excess and deficiency. So conditions of excess will manifest with sharper pain in the area, deficiency, so there is soreness that is relieved with pressure. So spleen deficiency may lead to soft swollen nodule at spleen 6, especially in gynecological conditions. Because the area is associated also, remember spleen 6 is the intersection of the spleen, liver, kidney, yin. It is sometimes difficult to know which channel or condition is involved when a change is palpated. So you should take into account other symptoms. Spleen 6 is associated more with the lower abdomen than with the specific indications involving Qi transformation of the spleen. Therefore, tenderness in the area may reflect a variety of infections or inflammations in the lower burner.